I'm here at the 2012 ATA Telemedicine Clinic, and I'm here with Juan from Medweb. And Juan, tell us about this photo as well as this box here. You know, what is this?
Okay, so this area right here is our mobile health station. And basically what we're doing here is we're using this box that is called a solar cellular network. So basically this little black box here is like a cell phone network. So in places where you have disasters or where the cell phone reception doesn't reach, you can install a box like this one to expand on the network coverage or to create a whole new network in itself.
So behind the photo I see that there's an antenna up here and 10-mile radius, is that correct?
10-mile radius. I think that this antenna, for purposes of the demo, it's like a 1-mile radius here, but you can just change the size of the antenna and that'll give you the radius that you want.
Okay. And tell us about this photo. Who is this person and what was he doing?
Okay, so all of this equipment here was developed for Afghanistan because we've been working in Afghanistan for the past 2 years and we've encountered people like this man. And this man, he is the director for the disease early warning system in Nuristan, Afghanistan. So this doctor travels around the whole region of eastern region of Afghanistan, identifying possible like disease outbreaks like cholera, pertussis, meningitis, just regular cough and cold, different diseases, and he's tracking them with a radio coding system. So he has to go meet the people, find out who is sick, get examples of their saliva or anything else. Excuse me. And then he comes back to the clinics and they have to analyze them, but they have to first take them to Kabul to be analyzed. And then they'll find out if they're actually infected with a major disease. So we wanted to help them because they were being a little bit slow in reporting because they would be out in the field and they didn't have a radio with them all the time, or the cell phone reception wasn't always good. They always had something. So we gave them smartphones where they could report and do geo-reference photography, and they could upload it on the internet as soon as they got a place where there was reception, and that could be uploaded on the web immediately. And anywhere in the world, but specifically in Kabul, they could look at the information and understand how the disease was spreading. So you would have reports from doctors like this one, from his assistants that were in other villages, and they were just traveling to every single village, looking at people and seeing who's sick and who's not. And he travels with a little computer, and he needed a printer. So we knew we wanted to help Afghanistan. We knew we wanted to do something good for the people. This man is, even though he's a director, he travels like in the snow, like from village to village, carrying his little computer, looking at families, and it's just amazing. So we're really happy that we could help him get his equipment, and that's the picture. That's the day I gave it to him, and you can just see it in his face.
Yeah,
really
great.
Happy guy. So this box works with all our mobile projects, and we have basically a project called IVR for Baby, which sends voice messages or text messages to women who are pregnant. So the women have to register themselves, or health, like a nurse could register them, and then every week they will receive a message saying what they're supposed to be feeling, what they should do, what they shouldn't eat, what they should behave, and what their husband should do for them. So in Afghanistan it's very difficult to work this because of the cultural context, and many women don't have phones. So you have to actually customize the message more for the male, for the father, for the lead of the house, and he has to get messages to understand that if he feeds his wife properly and he takes good care of her, their baby is going to be healthy. So that's not so much about giving health, but it's about giving education. So projects like this are supported by this white box because you can give communication to areas that don't have it. It's great education.